name's Tayla Hayes. I'm a student paramedic at Monash. Today is the 26th of September 2013, and in this video I will demonstrate various airway skills such as placing the patient in the lateral position, how the triple airway manoeuvre differs from the sniffing morning air position, safe insertion of an oropharyngeal airway and a nasopharyngeal airway, laryngoscopy and ventilations using a BVM. The stable side position. So firstly, you must ensure that the patient has no spinal injury, otherwise you cannot perform this movement. Secondly, you must ensure that the pockets are free of all sharp objects, as when you roll them over, it can protrude and cause further injuries. So this is a common error performed. So firstly, fold the patient's arm across their chest, pull the other arm out to a 90-degree angle, pull the knee, flex the knee closest to you, and slowly rotate over. Move the leg out to ensure that the patient doesn't roll backwards. Ensure that their arm is there. Firmly place the arm there and rotate the head to ensure to allow fluid movement out of the mouth and vomit for drainage. And make sure you monitor their breathing and circulation while they're in this position. The triple airway manoeuvre and how it differs from the sniffing morning air position. So first you begin by placing your right hand on the forehead of the patient. Ensure that your thumb is in line with their nose. Place your left hand on the mandible, your thumb on the top, your finger underneath the chin, and slowly tilt the head backwards while lifting the jaw upwards in a vertical position. This is the sniffing morning air position. The triple airway manoeuvre differs as it includes a jaw thrust as well. So you place your lower fingers underneath the jawline, place your thumbs on the zygomatic bone and slowly lift the jaw forward. Now, a common error is people do not put the towel underneath the head. This causes hyperextension of the neck and therefore does not allow correct air movement into the airways. And you put a towel underneath the shoulders of an infant and there's no towel with a child. The insertion of an oropharyngeal airway. So first you measure the OPA from the lips to the angle of the jaw to ensure that it's not too big. Secondly, you must make sure that the patient is unconscious and therefore does not have an intact gag reflex, as if you put it in with an intact gag reflex, it can induce vomiting. So you measure it, then cover it with the patient's saliva to therefore lubricate it, ensuring that when you insert it there's no mucosal damage, as that's a common error. So you insert it upside down and whilst in the mouth slowly rotate it 180 degrees and firmly push it in. Ensure that the pharynx is on the outside. This enables a clear airway passage as the tongue is below it, ensuring that it doesn't obstruct the oropharynx. The insertion of a nasopharyngeal airway. First you begin by measuring the tip to the earlobe to ensure for correct size. You then lubricate with KY jelly to ensure an easier entry. You then pick the widest nostril, slowly tilt it, ensure that there's no obstructions. Then you push it in posteriorly. Ensure that you don't force it, as it could force it through the esophagus rather than the trachea. If there's any resistance, pull it out immediately and switch nostrils. You can slowly move it clockwise and anti-clockwise 45 degrees to ensure safer entry. A common error is that people use them when the patient has incurred a brain injury. This is bad as it can force the NPA into the brain, causing further damage. Laryngoscopy. Laryngoscopy is used so you can visualise foreign bodies easier and remove them. So you first begin by ensuring that the bulb is on and functioning. You put your right hand on the top in line with the patient's nose, your thumb, and tilt it back slowly. You insert the laryngoscope by the far right side and slowly drag it across, collecting the tongue and ensuring that it's in the molecular groove. This enables visualisation of the vocal cords, enabling better visualisation of foreign bodies. Slowly tilt the patient's head backwards, ensuring that they're in the triple airway manoeuvre. A common error is people lift the laryngoscope upwards. This can cause the teeth to break, causing further foreign bodies to enter the airway. So you must move it forward a little, but not lift up. BVM ventilations using the rigid face mask technique. So you begin by peeling the face mask on. Ensure that there's a correct seal by having your finger at the base and your thumb at the top. Make sure that your 3 fingers are gripping the jaw, providing pressure, enabling the correct seal. As a common error is people don't ensure that there's a correct seal, therefore it causes air to escape and proper ventilation is not performed. Ensure that you squeeze the bag lightly, as many people can force too much air into the lungs, causing overinflation of the lungs and hyperventilation. You should ventilate for 12 times per minute.